COVID. And then the other just being, I think, the experience that the world is going through right now in terms of change management from many angles, including COVID. So instead of taking more of a very high level academic perspective, I actually took a bit more of a laid back approach, if you will, and something that's very familiar to all of us. Once we get to some of those screens, you'll be like, oh, I probably sent those today on my text messages. And so I took a bit more of like a fun approach, if you will, just because I think it's a good time to sit back and relax and kind of take in some of what we can identify as soft skills, but the soft skills actually make and build your character and value, not only as a person, but also as a nurse and as a professional. And those are the things that will, at the end of the day, save you when you are going through a bit of a harder or tougher time. So like I said, in between, feel free just to jump right in. We're a pretty easygoing group. And if not, happy to address questions and concerns, and even maybe some of your own experiences at the end, because it's a safe space to do that. Like I said, I think the world is going through a lot all at once, and I think it's really awesome that we have this opportunity to share the space together, just to know that we're not alone, even though we're sitting alone behind a screen. So again, I'm Shara, and this evening, this is actually my first time going really live outside of my own social support network, such as like my family, my professors, Dr. Emmanuel and Dr. McGaldry, as well as the Dean Lopez from Western University are also attending, and my friends. So I feel very honored to share this experience and journey with you, because it is sort of out of my character to not necessarily remain private. And so let's walk through this together. Okay. So the agenda is really simple. Like, who am I? I'll go through that in case you're wondering who this survivor is. And I will review with you my daily operations that were mainly during the time that COVID-19 was prominent in Toronto, Ontario. And it's not to say it's written in any case, but certainly the fact that I want to kind of take you through the heights of the operations that I was managing while I had COVID. And then I'm going to go through a bit of a roller coaster that I know I went through, and both from a cultural, reflective, and mental health component certainly affected me in different ways, and I'll explain why. Following by personal reflection and just a few insights for you, in the sense of take what you want from it and leave what you don't need from it. And it's insights that came from my personal growth, and I hope that it can just shed a little bit of light for this group. Especially, I remember being in first and second year, and the pressure we can put on ourselves academically could be quite astonishing, and then other pressures that we have to live up to. So I'll kind of unfold what I mean by that as we move on. And this is really exciting. I'm getting some chats, and I will address some of this maybe toward the end, but thank you. Recording is being done by the host. Thank you. So, okay, so who am I? So this picture, I had makeup on. Right now, I don't. In fact, I will be completely transparent with you, and maybe some of you do this. I have coconut oil on my face because it's really supposed to soak in, you know, and get some hydration. And so that is one thing that I will say is also a shift for me. Ever since COVID, I don't really wear like the mascara or the makeup anymore. It's certainly grounded me in a different type of way in terms of appearance. And I think that's really important to remember as we kind of trail through my journey in this. And so that picture is not, clearly I don't look like that. I did not wake up like that. I woke up like this. And so I'll kind of bring that back toward the end of our conversation here. So beginning at the March of 2020 till present. So all of these things remain consistent in my life. So my work, Melanie did, thank you again for introducing me and the work that I do. And in the next slide, I'll go through the operations of that. And it's a pretty heavy workload. Like, as a nurse, you feel responsible for other people's lives, whether they're your clients, families. And within my role, I'm also a clinic head, like I'm a clinic lead. So it's also my staff that I worry about from all particular levels. And it's not just nurses. And I'm sure that there's a lot of leaders in this group in India right now that don't just help to shape staffing that's related to nursing, but they also do for allied staff, doctors, people in the community health system. So work is pretty taxing in its own way, but it's super exciting when a nurse can not only make change frontline, but also at a higher level. And then I have school. Like, obviously, I'm a huge advocate for academic work, as you can tell by how many dozens of letters I have behind my name, with my capstone degree, with my doctorate nursing practice degree, and I'm very proud of that. Well, finishing that up very soon. So balancing work and school is one thing that I can certainly say takes up most of my time and my energy. And then research, so certainly working with my colleagues at the University of Toronto, as well as Western University, and in my doctorate nursing program, in my scholarly project with regard to, what am I doing? How am I fitting this in? How can we disseminate? Because bridging research into practice is very important for me, from a personal level, for different reasons, but mostly because that is what will get our clients healthier. And for those of you that attended Bethany's presentation yesterday, she spoke very highly about public health and community health engagement and why preventative care is important. And this is exactly the reasons why I engage in research in my practice. And leadership and mentorship, I kind of blend together because I don't think that one can be a mentor without leadership competencies. So quite often, so in my office at work, I'm in like a glass bowl. So basically you see me all the time. My entire office is glass. So normally I'm putting lipstick on, but we're always wearing masks at work now. So I'm saving a lot of money on lipstick is really what I'm saying, but also just everybody's seeing me in masks all the time. And I just have a very open door policy. I have all of my staff coming to me quite often and just looking for that mentorship when they are anxious about COVID, looking for leadership when they're looking for change. And so I hold those roles very near and dear to my heart because I think everybody looks for leadership in different ways. I know, for example, I'll say it again, like Dr. Emmanuel and Dr. McGaldry, I would not have made it through this program without their ongoing leadership and mentorship. And it's something that you value and you want to bring forward into all of your roles, the things that you want to take from it and things that you may not want to. You learn what fits for you. And then last, I also have a social life. I'm in Toronto trying to, date, and my parents are asking when I'm getting married, and trying to, maintain contact with my friends and my family, and, just trying to learn piano, like doing other things in my life that are not work and school related. And so I joke about all of those things because I remember when I was in India with a few folks from this group, I remember talking about those stuff with you guys, and you're like, oh my God, I like this person. What do I do? It's a very real life piece that we all need to engage in because that's what makes us human. And so as you can tell, the workload that I have here is very large, and it's not in comparison to, let's say, like working parents or people that are taking care of their parents. Like it's mine looks very large for me, but I can't imagine other people that have other responsibilities on top of that. And then all of a sudden I got COVID. So come March, I began to experience symptoms while I was kind of engaging in all of these other areas in my life. And so it is a part of my story and my journey now. But first, I just kind of want to take you back to what my working day typically looked like, specifically from work, because I think as nurses, this is really good exposure for you to kind of understand what jumping from frontline into leadership may look like for you. And I'll admit this is maybe a bit more specific as per Toronto's public health system, but I think it's certainly things that can be taken with you as you please. So long and short of it, I'm not going to go through point by point, but just to illustrate the busyness of my days. So in between school, the social life, and all of that good stuff, my work days were 14 hours. And so all of my meetings started at anywhere from 6 to 7 a.m. and I didn't finish until almost midnight. And why? Because within a month, our hospital was able to build another inpatient unit to manage COVID positive clients that we were anticipating of receiving. And this included operations, so building all of the beds, making sure that they were all separate units, understanding where hand washing would be, how to integrate infection control policies appropriately, how to implement new policies about visitors, what to do with the bodies if, when and if they do pass away in a safe manner, and overall what to do to manage staff anxiety, because a lot of people were feeling very concerned. What if I get COVID? What if I take it home? I have small children. I'm taking care of my parents. And just recognizing it was such a thunder of mixed emotions, mixed reactions. And I think in some ways we saw different versions of people come out, because people had anticipatory anxiety about this naturally, because we're under a pandemic, we're under a state of emergency. And what did that mean for people that needed groceries? What did that mean for people that were driving into work? Like, all of these things are not even nursing focused. They are things that you and in leadership within healthcare will need to think about during a pandemic, because at the end of the day, people look to you not only for frontline support, but beyond that. And that's what I mean about leadership and mentorship. People will look to you in your roles and be like, well, what would Melanie do? What would Bethany do? Because you will establish a reputation for yourself that will be trustworthy. And so people will look to you for that. But then once you say something that they don't want to hear, so for example, in Toronto, our public health system was saying we don't need to wear N95 masks, we can only wear surgical masks. And people really took that to heart. They felt very concerned about that. So having to manage all of that over 14-hour days, including weekends, and for living in Canada, those are very long work days consecutively for us. It was a lot. And so those were that's just like a snippet of my daily operations timeline. And for those of you that may be aware, like just building business cases and kind of sourcing out additional funding and building out those timelines and rationalizing why I needed those extra dollars to build an additional 20-bed unit needed to all happen very quickly in order to meet the needs of our clients. And so that, although it was very high pressure, in retrospect, I mean, it was one of the best situations to be in, because I was able to critically think about my resources and really implement that quickly. But while all of this was happening, I made my staff very aware that I am more than available. Call me, text me. I was also on call a lot during that time, which means that any time of the day or night, my staff would call me if there is a crisis, like if there's a death, if somebody was overdosing on substances, if there was a mental health crisis, if staff were having issues and they were spiraling. So I was called beyond the 14-hour days that I was working. And so through that, I remember the week of March 17th, when things were really starting to close in Toronto, Ontario. I just remember feeling a range of symptoms that I was just like, what is this? And so to illustrate what I was really going through, I made this very high level academic smart graph for you guys. And so I kind of just thought, again, kind of going back to let's make it light and easy, because this is a heavy topic for many. Let's use Bitmojis. So if you didn't use any of these today, you probably will in the very near future, because this is what we do. So to explain how we're feeling. And so at the time, I remember in the first few days of my onset of symptoms, I remember my mind kind of, and I don't know how else to explain it, but this, it was sort of like, it felt like it was exploding in different areas. And that's a very large way to kind of describe this, but it just felt like I could not concentrate, and my mind was just, it wasn't a throbbing that's headache, but it was a throbbing. And I just thought, holy, I must be stressed. Like, this is just stress. I'm not sleeping well. This is just me overreacting. And I did not pay attention to that at all. And I'll go through the reasons why I didn't pay attention to that. And then I just found through midweek, I started to have a runny nose. And I was like, okay, I know that this could be one of the symptoms, but I'm also recognizing
when it comes on, I'll tell you.
Sorry. Okay. And then, so I was just having a runny nose, but then I'm like, you know what, we're all wearing masks. And sometimes when you wear them for a long period of time, that starts to happen. So I didn't actually think anything of it. And then all of a sudden on March, I think it was 18th, I remember becoming really, really, really fatigued. Like, this was one of the key symptoms. And I remember it was like a Thursday morning or a Wednesday morning, I should say. And I just woke up and I was like, why is it not Friday yet? I was so fatigued. And then that moved into a lot of bodily pains and aches. And I was like, I don't have COVID. And in fact, I was more upset because I was more so like, I need to go to work. I have all of those operations I just showed you guys that I need to plan, roll out, disseminate, make sure my staff are okay and the clients are being taken care of. And so I spoke to the chief medical officer and he's like, Shara, listen, just go get checked. This is a very contagious thing. And, I was just like, okay. And then through that, once I got to this stage of bodily aches, I was like, you know what, do I have COVID? This is just before I went to go get tested. And at the time in March 2020 in Toronto, basically they were saying if you have a fever, runny nose, and cough, you probably have COVID. Out of all of that, I had a runny nose, but it was intermittent. It wasn't even consistent. So I was like, I don't have COVID. These are the only symptoms or key symptoms that they're saying that, you should look out for. So once I got to this stage and my CMO was like, listen, Shara, just go get checked. I went in line and I got checked. And at the time, public health was so backlogged by the entire system of being checked that I actually didn't get my results for 7 days. And indeed, a week later, I found out I had COVID. And during that time, that time I was getting checked, I was working from home. I did not stop working. And even after I found out I had COVID, I kept working for the next month and I worked from home. I was like, no, I thought it was a bit of a mind game. And I was like, I'm not going to give in to this. I probably have a mild case. And then during that time, I couldn't settle. Like, I was on interview panels for my chief nursing officer and I was so exhausted. I don't remember the last time I've ever felt that fatigued. And, my boss would be like, Shara, maybe you should hop off this call. And I just felt like, so awful about myself. And then it was at that time when I was doing many of the interviews, like a week later after I got the news I had COVID, that then I had to track back with everybody at work that I was in contact with for more than 5 minutes without any PPE on, and all of those people had to find out that I had COVID, and all of those people had to go home and quarantine for 14 days. And then I felt so bad because I was like, all of these people are now at home, and it wiped out the entire leadership team at work. Although nobody actually got COVID, they all now needed to work from home for that time, and all of the frontline staff were very confused as to where leadership was. And then a week later, I started to get shortness of breath. And I was just like, you know what, I have asthma. This is not a big deal. Again, thinking it's like a bit of a mind game while knowing everything that's being published from Toronto Public Health, but almost in denial, I think. And so it got to the point where I would be resting, but I couldn't talk on the phone and rest at the same time, or I couldn't make a cup of tea and be on the phone at the same time because the tightness in my chest was so heavy. And that is rare for me, although asthmatic, because I would only use an inhaler maybe once or twice a year when I do my extreme workouts. And so, so I really had little to no energy. And then I was also having tightness and shortness of breath. And so I just kind of laid here and didn't think anything of it. And I'm like, no, I'm just going to continue to work. I have to finish my chapters for school. I need to make sure my staff are taken care of. I just said, I slowly but surely wins the race. And then about a week and a half later, I lost my smell and my taste. And, you think that I would stop eating, but I think I ate more during that time just to test out the taste buds, and they really weren't working. So I gained a bunch of weight, but I didn't taste anything, so it made no sense. So it was, but these symptoms came, I would say, roughly a week and a half to 2 weeks later. And again, it's not in alignment with the Toronto Public Health guidelines with regard to symptoms. And then all of a sudden, I just started to get a little nutty, like cabin fever, where you just feel like you're in a box. You feel guilty because all of a sudden you have COVID, and I work in healthcare. Like, why why would I get that? I'm responsible. I've been trained to be responsible. I should be able to control this. And so after feeling a little nutty, I just ultimately felt guilty. I felt so guilty for first of all sending half of my team home because they were in contact with me, although they didn't actually get COVID. I felt guilty for not being present at work, although I worked every single day for my 14 hours plus. I felt guilty for even there was a large part of me that didn't want to tell my family or my professors or my friends, because I'm not that person to necessarily go out and reach for help. And also I think in healthcare, and I think a lot of the nurses in this room will be able to resonate, you feel like you have control over something because you're the caregiver. You can't get sick. You know better. You know not to touch your eyes. You know to wash your hands. And so there was nothing more that I could feel except for guilt. And I was going a little crazy in my house. And when I say crazy, I really feel like I was really hard on myself. The negative self-talk was awful. And even asking, because we weren't allowed to leave to do groceries. Even asking for people to do groceries for me was a big deal. Like, I'm still a little sensitive about it, but like I wouldn't ask, and sometimes like I just wouldn't necessarily. It's not that I was avoiding eating. I just would wait until I was offered, because that's just the person I am. So COVID really took me. It just takes you on a bit of an emotional roller coaster, and I'm sorry. And it's important to really point this out, because as healthcare providers, we hold ourselves so highly accountable and not always recognizing that we need to do that for ourselves. And so this is basically just what I went through in terms of, what I went through mentally, which was just, feeling guilty and shocked. And the fact that it took almost 8 weeks to get a negative result was really hard, because I felt like I was letting everyone down, although you have no control over it. And I'll admit, it's the first time I ever had to deal with like an illness that was characterized in social media as something that was really concerning. And so I imagine, and this is an assumption, so take this with a grain of salt, I imagine that maybe somebody that, has been diagnosed with something else in the past, whatever that might be, might have managed this differently. So I acknowledge that this is like my first real exposure to an illness that is characterized as something that's really negative in some way, because death is a large part of the conversation, at least at that time. So lots of emotions. And so I think what brought one of the competencies that I want to review with you guys, and this is why I said at the beginning, the soft skills piece. I think when we're in nursing school, we're taught so well the medical piece, the tangibles. You can see this. What is the, what are your tests telling you? What does that urine sample tell you? The blood. Let's get the blood. Let's check out your enzymes. Like, we're so good at that kind of stuff. And even being a mental health nurse, I obviously still haven't mastered this. And this is what I want to bring to you today, is a personal reflection and why this competency is so important. So in May, last month, my aunt in New York, and if you watch the news and stuff, you know that New York was a hot zone for COVID, and just recognizing some of the challenges they had with PPE and access to care and stuff like that. So she was 63. and she had her own ailments, but they were controlled. And then she got diagnosed with COVID. And so at this point, I recovered, I returned to work. And then in May, mid-May, she passed away from COVID. And the distance that COVID has created among all of us, whether you have it or not, is that you can't be there with your family in person to console. So what we did to support the family was we had a Zoom meeting. And on Zoom, you know, prior to this, I'm sure you all saw your pictures or your names were lined up all together. And so during like prayers and just support, and we went to the burial ground with them through Zoom, everybody was on that sort of master grid. And the experience of watching everybody grieve at the same time is very different compared to speaking with one person at once and saying, oh, I'm so sorry for your loss, and then going to the next person. And so just that experience of the distance created the opportunity to see everybody grieve at the same time, because I think it is a different grieving process than what we're typically taught in school. At least for me, if I can say that, because normally it's very one-to-one or small groups, but this was like a very large group of people grieving very differently, and you had to see it. You couldn't not look. You couldn't not see everybody's expressions and their tears and hearing it, and not being able to go to the burial ground, not being able to cross the border, not being able to hug their grown children with their own kids, but they lost their mother, and they lost their mother to COVID. And it's only at that time did I really come to terms with the fact that I had COVID. And this is what I need. Like at the beginning, I really told probably less than 10 people. Half of the people are on this call. I didn't want to tell anyone because of that roller coaster I was on. And it's only when I lost my aunt to COVID did it make it real. And it's unfortunate, because that's sometimes how humans are unintentionally, where it's only until maybe you're more affected that you take consideration into an issue. And I think we're seeing that right now in the world in so many different ways, COVID and other issues. So once she passed away, I remember feeling this in control feeling still, and guilt and all of that other stuff I pointed out. But after the funeral, and then I was just sitting in my apartment as I was for like a month and a half, and I remember just sitting here and recognizing, like, I dishonored myself. I truly disrespected who I am as a person, and not recognizing, like, we as healthcare providers can get sick, you know? And I suspect that there's probably cultural components associated with my thinking or the way I was raised. We all have our own experiences and journeys. And I, for the first time, understood that I needed to be okay with not being in control, and being okay with illness, because I think we stigmatize illness, but in fact, it's a part of life as death is. And I think if we can reshape some of that messaging upon reflection, we can then hold ourselves to a higher integrity. And what I mean by that is this, I identified structural integrity. For the fact of the matter is, and this is kind of the way I think, we all have this shell, right? We all have a shell of our body, but the integrity of that body is held up by your organs, your lymph nodes, your blood, everything that's working right now without you even knowing it. Your lungs, your enzymes, whatever's, you know, your insulin's breaking down all the sugar, like everything that you're doing to your body today is affecting the integrity of your shell and what it encompasses. And that is also dependent on whatever genetics you may be blessed with, and other things that we don't have control over, like pollution or something like that. But the integrity of your mind is very separate as well. And I say that intentionally because if you recognize in the slide prior, I spoke a lot about my emotional roller coaster. And we can become so focused on the physical, and we hear, oh my gosh, like my heart rate's going up, my breathing, my this, my that. But in actuality, if we actually consider the mental integrity of who we are and our mental wellness, about taking care of ourselves, it's okay. And it's okay to welcome illness. It's okay to accept loss and death. And it's okay to find integrity in those life experiences too, so that you don't break down your own physical integrity, your own home. This is your home, your body, your mind, your physical. That's your integrity. It's what holds you up every day. It's what's holding you up to not only comprehend this information, but physically sit up and do this. And most of us, I think tonight, are lucky that, we're not bound from specific, let's say disabilities or chronic illnesses or whatnot. But I think, and I say this with confidence, whether you're a nurse or not, I think we're all bound to lack of integrity from a mental health component. And whether you think that's a soft skill or not, because I think in North America, certainly it's becoming a bit more attractive, but understanding the intangible makes it soft, but it's not. It makes or breaks a situation in how you decide to make decisions, on how you decide what relationship you're going to get into. It's also part of the reason why you decided to come into this program and why you chose to sit here tonight. Is it because your teacher told you to? Is it because, are you paying attention? That's also something to consider. Or is it because you actually wanted to be here? And what are you getting from this mentally? And is it distressing? Because this information is still very even new to me. And so recognizing what you're feeding your mental integrity and your physical integrity really makes a difference in terms of how you engage in reflective competencies, not only as a nurse, but just as a human being. And I didn't recognize the destruction of my own mental integrity until my aunt passed away. And I actually didn't pay that much attention to the physical integrity of my body either. Recognizing the tightness in my chest, I was just like, you know what, it's fine, I can get over this. And that also then fed a negative experience mentally. And so one thing that I think came to mind in terms of learning, and I don't know how familiar you are with this, but in mental health, dialectical behavioral therapy is often, it was originally designed for people that have borderline personality disorder, but certainly these principles are something that all humans could use and learn, and not only in relationship with others, but in relationship with yourself and building that integrity for yourself. So very quickly, I'm mindful of time. The 4 components are mindfulness, which we're hearing a lot about, just, being aware of your own judgment, your own bias in all these sorts of ways, and personally and in the world. Emotional regulation, so understanding what's going on to reduce your vulnerability and manage your emotions, because it is okay to be sad, it's okay to be angry, it's okay to be happy. It's very human to go through emotions, but it's regulating it so that you feel comfortable with yourself and in relationships that you're in. Distress tolerance, so how to manage a crisis without worsening the situation. And I would like to focus on this one just very quickly. I think I lean so much into this particular category that I just accept reality for what it was, being very concrete, and to the point where I didn't let any emotion in. And being that guarded is also destructive to your integrity, because then you end up turning against yourself. And if you're not your biggest cheerleader, it's not going to work out in the long run. And then you have interpersonal effectiveness. So getting needs met, maintaining relationships, and increasing self-respect in relationships. So it's not getting needs met. So in the sense of, I don't have any food, I have COVID, can you do groceries for me? It's more so expressing it in a more thoughtful manner and recognizing who you can be safe with to share those thoughts with. And so that's a very quick overview over DBT principles. I'm happy to share my contact information to go through it a little further, because these principles are something that I think will be demonstrated differently across cultures, across, you know, nations and religious beliefs and things like that. But certainly it just helps you to accept reality, build healthy boundaries, but also be kind to yourself and other people around you with very little judgment. Excuse me. And so after all of that, I added this person because I just feel like this is the way we need to end. It's okay to cry during this presentation. I have allowed myself to do that, and I've also just allowed myself to be okay with presenting this information. And when Bethany and, you know, your professors and our professors were engaged, you know, do you want to talk about speaking about surviving COVID? And I had a very different response than I would have had in early March when I told less than 10 people. And I think it's important to tell our stories and to tell them with respect, not only for each other, but to ourselves. And recognizing, like, humans fluctuate, and it is okay. It is okay to not be okay. And finding ways to cope with that is going to be the most important thing that those DBT skills can, and reflective competencies, can offer you. And so to help other people, like, I've also engaged with the Canadian Blood Services here. I'm donating my plasma. I said, yes, like, let's go for this. Let's help as many people as we can. And like I said, I'm giving talks. Chitkara University is my first. So thank you for allowing me to be vulnerable with you. And, you know, for nurses, just really engage in your studies, engage in what your professors are teaching you. You will be out there saving lives, but engage in yourself. And you, like, engage in getting to know yourself, not only physically, you know, but also your mind, your body, your soul being, whatever that might be to you, whether it's religious or spiritual. And do what is important to make yourself healthy in the sense of, you can manage your happiness, but you can also manage the roller coaster that life will bring you, because we don't have control over everything. So work on and it sounds kind of preachy and advice-y, I think, but it's really about recognizing that if you are not in a good state to take care of yourself, you can't take care of your clients. You can't necessarily take care of your staff if you go into leadership, because I even see a shift with myself, with my staff now. I'm not as on edge, and I'm a lot kinder, and I have a lot more patience. And sometimes I think life takes you through roller coasters on purpose to help you get to that other side of what you were missing. So welcome these things into your life so that you can be a better human to yourself, but to your clients and to their families, because they look to you for your leadership and mentorship, especially during these hard times. And so that is my presentation about surviving COVID. And I apologize. I think I have a few questions here, but excuse me, crying, it just does things to you. So, these are very nice comments. Thank you. So I welcome you guys to, you know, take off your mics and share questions and concerns that you have about this, because it's a real thing, and I don't think it's going anywhere, but certainly recognizing we will get through it together. So if anybody's comfortable, please, you know, share. And if not, I will certainly read through these comments afterward. There's just several, so I don't want to take up everybody's time because I think I went over time, so my apologies. So does anybody have questions or wants to share?
Thank you so much, Shara. That was just such a wonderful insight into your experience. Thank you for being so vulnerable with all of us. And if I could ask, if there are any comments or questions from our audience, we have quite a few people here today. If you wouldn't mind raising your hand, and then we could then call on your name to unmute yourself to ask or make a comment. Don't be shy.
And that's okay. I mean, geez, it's like 9 a.m. there. That was a lot. And it's only Tuesday. Oh.
Hi, Shara. This is
Hi.
Bisht. I'm principal at Chitkara University College of Nursing HP campus. Hi, Bethany. Hi, Melanie.
Greetings. Hello.
Your talk was so moving. Actually, that is why I think nobody is saying anything, because they are extremely, touched. The way, the roller coaster ride you have taken throughout the journey, you have told since, the moment you got detected, and all those phases of grief you talked about, first the denial, first you said that, you were not able to accept the fact you are missing your work, you were feeling guilty about it, right? And then slowly moving on with those symptoms, and then still not accepting the fact, and you wanted to work, all those things, and then the death of your aunt. I mean, it was so moving. Finally realizing, the acceptance, how it came, slowly realizing what mental integrity actually means. So, and then how you linked beautifully with the DBT skills. So seriously, Shara, I'm really so impressed. I'm a mental health professional. My specialty is psychiatry, but the way you have expressed, I mean, you just moved everyone. So thank you so much. And the takeaway of this session, I think the most important is be kind to yourself, respect yourself. Even if, we are health professionals still, even I'm also like this, frankly speaking, we ignore our health, and that is the fact. Being in health profession, we know everything, and still we take care of everyone except ourselves. We take our health granted. So that is very, very nice. So thank you once again, Shara, for this wonderful lived experience. And you're really brave. You're really brave to bring out the honest confessions of your emotions. Thank you.
Thank you. Thank you so much for that. I appreciate it.
I think Meenakshi, she raised hand. Meenakshi, you can go ahead and ask the question. Meenakshi, are you able to hear us? I think her audio is not working or some other problem.
I have one other audience member that's asking to address the room. Dr. McGladrey, you may unmute yourself.
Can you guys hear me?
Yes.
You can. Okay, good. Sorry, I'm on my phone. So I just wanted to really thank Shara for such a wonderful presentation, and just on behalf of the faculty, Dr. Emmanuel and I, we have watched the growth of all of these participants in your program here, Bethany, Shara, and Nancy. And I just wanted to congratulate all of them. And then I just wanted to applaud Shara for being comfortable with being vulnerable, so that we can all understand the impact that this particular pandemic is having on us. So thank you very much. Know that Dr. Emmanuel and I are so proud of all three of you.
Thank you. I'm speaking on behalf of the three of us. We appreciate it very much.
You're all very special to us.
Are there any other questions or comments?
Thank you, Shara. In between, I couldn't join, but till the time I was with you, it was really a wonderful talk. And particularly, I think for our students, it was a well needed talk. And because we all are going through this pandemic, and we all should share our experiences, how we have cared or how we have gone through the journey. So it was really appreciable that you have shared your experiences, and I really salute you the way you have come through this particular experiences, and you have come so strong in the end. So well done. Thank you so much, Shara. Any other?
Shara, it's Melanie. I just want to just briefly just say, just thank you for being vulnerable and raw. It's very, very difficult to do that. So I really appreciate that, and you're sharing your story. And I actually think it's a perfect segue into tomorrow evening's talk about resilience, because you talk about the epitome of resilience. I'd have to say it's definitely you and how you've come out on the other side of all this. So thank you for your story, and we'll definitely be mentioning you a lot tomorrow evening when I do my talk on the resiliency piece.
Well, I can't wait for that talk.
Yeah, Melanie, we are looking forward to your talk too tomorrow. Thank you.
Well, if there isn't anything else, I know your professors, and I think some of you I might have shared my information with when I was in India at Chitkara University. Feel free to reach out to me if you have any questions or concerns, because like I said, similar to Miss Bishop, my background's in mental health and addictions, and so while this has been a journey, it's only one journey, and so many of the skill sets such as DBT along with others can be shared with everyone here in different scenarios and can be tailored to meet needs in different ways. And I'm certainly happy to help students kind of go through that, because it's so easy to go through a bit of a rabbit hole or tunnel vision about what the goal is, but also widening that goal to meet your needs as a professional and in personal lives is equally as important. So I'm happy to have those conversations if and when it makes sense for folks.
Thank you so much, Shara. We really enjoyed your deep sharing with us tonight. And thank you to all of our guests and our esteemed colleagues. And we look forward to another lovely talk tomorrow. And what a blessing to have these three talks be so perfectly aligned with one another. Again, it's been such an honor, and I hope that you will all have the most lovely day.
Thank you. Thank you. Thank you, Bethany, Melanie, and Shara. Thank you. So see you tomorrow.
Yes.
Have a great day.